Hey everyone, Dr. Mike here, and welcome back to HGH Health Hub, Recover and Thrive. You know I'm passionate about giving you the knowledge you need to live your healthiest life, and today we're tackling a topic that affects so many people: arthritis. Arthritis isn't just one thing, it's a whole group of conditions that cause joint pain and inflammation. We're going to break down the different types of arthritis, explore what causes them, and most importantly, arm you with effective coping mechanisms to manage your symptoms and live a more comfortable, active life. Remember to stick around until the end for some valuable tips that can make a real difference in your day-to-day life. Don't forget to like, subscribe, and hit that notification bell so you don't miss out on future health insights. Let's get started. So let's start with one of the most common types of arthritis: osteoarthritis. You might hear people call it wear and tear arthritis, and that's a pretty good way to think about it. It's the most prevalent form of arthritis, affecting millions of people worldwide. Imagine your joints like the hinges on a door. Over time, those hinges can get squeaky and worn down with use, right? The same thing happens to our joints. Well, osteoarthritis is kind of similar. It's a progressive disease that worsens over time. The cartilage, that smooth, slippery tissue that cushions the ends of your bones in a joint, starts to break down. This breakdown is a gradual process. It's like the protective coating on those door hinges wearing away. Without this coating, the hinges can't function smoothly. As that cartilage deteriorates, the bones start rubbing against each other. And that's what causes the pain, stiffness, and sometimes even those grating sensations you might feel. This can significantly impact your quality of life. Now, osteoarthritis is more common as we age. It's a natural part of the aging process. It's like putting a lot of miles on those door hinges. The more you use them, the more wear and tear they experience. Years of use, along with everyday wear and tear, can take a toll on our joints. This is why older adults are more susceptible. But it's not just about age. Other factors can contribute to the development of osteoarthritis. Other risk factors come into play, like genetics. If your parents or grandparents had osteoarthritis, you might be at a higher risk. Some people are simply predisposed to developing osteoarthritis. It's in their genes. If it runs in your family, you might be more likely to experience it too. This genetic link is an important factor to consider. Injuries can also play a role. Joint injuries, even those from years ago, can increase your risk. Think about athletes who put a lot of stress on their joints, or people who've had previous joint injuries. These stresses can lead to early onset of osteoarthritis. Those injuries can increase the risk of developing osteoarthritis down the line. It's a cumulative effect. Obesity is another big one. Carrying excess weight puts additional strain on your joints. Excess weight puts extra pressure on your joints, especially weight-bearing joints like your knees and hips.